9:32, and I will go ahead and call the meeting to order with welcome, and we will go around the room and introduce ourselves in an effort to establish quorum. So let's start here, work our way around.
Jacqueline Aaron, I represent Oklahoma CASA Association.
Brian Larison, I'm the CEO of Alliance Meadows of Hope, a foster care agency, and represent Oklahoma Care. It's a group of children's agencies, residential care, and foster care in the state of Oklahoma.
My name is Michael Johnson. I apologize for my voice. I've going on 3 weeks now, trying to get my voice back. I am representing Oklahoma Bar Association.
Hannah Whip, I'm the director of the Oklahoma County Juvenile Bureau.
I'm Mary Malone Tully with MT Willow Tree Consulting.
Shell Millington with OJA.
Mike Warren, and I represent the Supreme Court.
Jason Hicks, I'm the DA for District 6 and represent the District Attorney's Council.
Haley Kurth, I represent the PAR Board. I'm the director at Rural Health at SWASU.
John Schneider, Youth and Family Services over in Canadian County, and I'm here representing the Oklahoma Association of Youth Services. So we have quorum?
Yes.
We have quorum. All right, thank you. Thank you, Ty Matty, for being here as our Assistant Attorney General. They keep me in line and keep us on track. I appreciate it. Is there anybody, agenda item number 2, anybody sign up for public comment? Okay, we have no public comment. We'll move on to agenda item number 3, discussion and possible vote regarding the minutes from March 26th, 2026 commission meeting. We have a motion.
Make a motion to accept the minutes.
I'll second.
Okay, we have a motion and a second. Any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Abstain.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
All abstain.
Thank you. Next, I'm going to move some things around here a little bit. We're going to go to agenda item number 9, report from the OCCY Parent Partnership Board. And I will welcome up Nancy I'm so sorry.
Charbonneau.
Charbonneau. Thank you for being here.
Good morning. Good morning, commissioners. My name is Nancy Charbonneau. I'm an OCCY Parent Partnership Board member with lived experience in homelessness, domestic violence, mental health, and I was once a foster youth. I'm a single parent to 4 children living in Weatherford, Oklahoma. I am currently receiving TANF benefits, and I'm 1 test away from obtaining my high-set diploma. I also have plans to study radiology. My goal is simple: to build a career, support my children, and become fully self-sufficient. Alongside being a parent, I volunteer with several organizations focused on the safety and well-being of Oklahoma children. I care deeply about protecting children and supporting families, but I've learned firsthand that none of this is possible without reliable childcare. In 2023, I drove more than 70 miles a day between Clinton, Cordell, and Weatherford just to access childcare while working a fast food job. Those hours were physically exhausting, emotionally draining, and expensive, but I did it because I needed to provide for my children and keep them safe. Right now, I do have reliable childcare, but it took about a month of separating my children between different providers to make it work. After the provider I previously relied on shut down, along with several others in my area. While I was eventually able to find stable care for my family, many families like mine still have very few childcare options available. I have also experienced serious instability in healthcare. My Sooner Care coverage was shut off without notice due to child support actions involving my child's father. One day I had healthcare coverage, the next I did not. There was no warning, and it created immediate stress while I was trying to care for my children. During that time, I was also without access to my own medication for about a month. It reached a point where people close to me noticed the decline in my mental health and ability to function day to day. That experience showed me how quickly families can lose stability when healthcare coverage is disrupted without notice. I also received a bill for my son after a well child visit that I understood would be fully covered. That unexpected bill added financial strain and confusion during an already unstable period. These experiences are connected when childcare, healthcare, and basic supports are unstable. Families are pushed into crisis instead of being able to move forward. This instability affects children directly. Children need consistency, routine, and stable caregivers. When care changes frequently, it affects their sense of security, emotional development, and overall well-being. Without stable childcare, parents are forced into impossible decisions. We rely on unsafe arrangements, take on work schedules we cannot sustain, or miss opportunities to further our education. In every case, children are impacted. The stakes are high. According to the CDC, at least 1 in 7 children experience abuse or neglect each year. And children in financially stressed families are at significantly higher risk. Research shows that access to stable childcare reduces neglect and improves child safety. Childcare is not only a workforce issue, it's a child safety issue and a stability issue. In rural Oklahoma, the lack of childcare options affect every part of a family's future. Without it, parents cannot reliably work, attend school, or build long-term stability. I cannot complete my HISET or continue into radiology with training without knowing my children are safe and cared for. This is not just my story. Families across rural Oklahoma are facing the same barriers every day. We are doing everything we can, but the system is not built for rural families. Investment in childcare would provide safe, reliable, and sustainable options that allow families to move forward instead of staying stuck in crisis. I'm ready to work. I'm ready to learn. I want to provide for my children and give them a stable future. But without childcare, that path is constantly out of reach. I'm asking you today to support childcare funding in rural Oklahoma and to strengthen the stability of support systems that families rely on, including healthcare coverage. These investments would allow parents to work, pursue education, maintain their health, and support children's safety and development while helping families build lasting stability instead of constantly facing crisis and uncertainty. This is not just about economics, it's about children, families, and the futures of our communities. Thank you so much for your time and consideration.
Thank you so much for sharing your story. I think the journey you've been on is it's just very amazing for you to share that with us, and the level of tenacity that you've had as you've attacked that journey and said, you know, there's challenges, but I'm going to keep moving. That takes a lot of courage, and so I really commend you as you continue to walk that path and take that courage to do what's best for your kids and for yourself. And thank you for sharing that journey with us, you know, as we strive as one group to better the state and better the system. So I appreciate you sharing your story. Thank you very much. Thank you. Okay, we'll move on to agenda item number 4, discussion and possible.
Next one.
We're going to go ahead and do those first. Okay, we'll move one more thing around. We'll go to agenda item number 10, report from the Oklahoma Youth Advisory Council, and I will turn it over to Rex Templeton.
Hello. My name is Rex Templeton. I'm from the Oklahoma Youth Advisory Council, and I'll just be giving y'all a couple of updates about, you know, who we are and what we've been up to. Just go ahead. Am I able to see my screen?
Yes.
Okay, perfect. So once again, I'm Rex Templeton. I use they, them pronouns. And so first of all, what is OYAC? The Oklahoma Youth Advisory Council is a statewide youth advisory body. We're focused on mental and behavioral health. We consist of 12 young people from 16 to 24. 8 of us are from urban or suburban areas, and then 4 of us are from rural areas. We all in both state and community systems. We aim to provide youth perspective on mental and behavioral health services and policies. Our goal is to ensure that youth and young adult voices are meaningfully included in decisions that affect children, youth, and families across Oklahoma by elevating lived experience and community insight. And then a little bit about me. So I'm 19 years old. I am queer and non-binary. I'm also disabled and chronically ill. I have autism, POTS, MCAS, Ehlers-Danlos, and a lot of other conditions. I was born in Texas, but I moved up to Tulsa about 2 years ago. Since living in Tulsa and even a little bit while living in Texas, I've experienced homelessness. I've been, kind of everywhere. I've lived on the streets. I was in a shelter for a little bit. I spent most of my time couch surfing. Since moving up to Oklahoma, I have been a Sooner Select recipient. So I have Oklahoma Complete Health through Sooner Care. And then as a kid, and even now with some of the work that I do, I'm frequently in contact with DHS and CPS. I grew up around, a lot of people in foster care. I'd say probably about 90% of my friends were in foster care growing up. Right now I'm involved with a couple of different community engagement opportunities. So I was a guest speaker on the Focus Black Oklahoma podcast. I talked about what it's like being queer and homeless and some of the extra challenges I faced because of that. And then I'm also the social media coordinator for the Youth Services of Tulsa Youth Advisory Board. But I joined OYAC because I wanted to make an impact on a larger scale. With the Youth Advisory Board, I make an impact on a very local scale, and I wanted to, be larger, make more of an impact, help more people. I love, helping with the day-to-day stuff, but I want to make lasting improvements that's going to help people, who've experienced challenges like me. So here's kind of what we've done. I apologize. This was our spring, what we've done for our spring meetings. So in March, we had our meeting launch. We had our first meeting. We had both our orientation and our first meeting, where we mostly focus on just getting to know each other, setting some ground rules, talking about what OYAC is, what we're going to be. And then we had our second meeting in April, where we focused more on engagement opportunities. What exactly do we want to do? Who do we want to get involved with? Different ways that we could get involved with, the community, with different organizations. And then in May, we did the Youth Risk Behavior Surveillance System, so the YRBSS. I'm not sure if any of y'all are familiar with it, but it's basically just something that goes out to all high schoolers and is a risk analysis. It's like, I believe it's like 99 or 100 questions that just asks youth about, how much do they drink, how much do they smoke, what's their depression levels like, anxiety, stuff like that. Well, we partnered with one of OSDH's epidemiologists, his name was Thad, and we discussed, the priority, then the wording of a couple of those questions, just to get some youth voices on it. And then coming up for this summer, we have our meeting on Tuesday, June 23rd, where we're going to be mostly focusing on communication and then really outlining some more like hard goals. So we're going to be discussing, the PALM and the SMART acronyms, and just really refining our communication through like Microsoft and stuff like that. And then on July 28th, that is our strategic sharing training, where we'll learn how to share our experiences concisely and deliberately to get, combined years of experience into, just a couple of sentences, be more concise and, really use the most of what little time we may have to speak. And then August 8th is our summer retreat and planning. So OYAC is going to meet in person in Oklahoma City. We're going to just have a couple of days, enjoy the summertime, and also just work on some strategic planning, more on what we're going to do over the next year and, lay down some like hard plans. Okay, that is OYAC. Do you have any questions for me?
All right, well, thank you so much for your presentation. Thank you for your work and for diving in with the willingness to go deeper and be a part of something bigger than just, as you mentioned, just the day-to-day and dive deep. So I appreciate it. Thank you so much.
Yeah, of course. It's my pleasure. Thank you for having me.
Okay, we will circle back to agenda item number 4, discussion and possible vote regarding the finance report. And I'll turn it over to Mark James.
Good morning. So we're going to just give you an overview of our financial situation for the agency since May 31st of this past year. That's the latest numbers that we have. And just as a reminder, OCCY contracts with OMES's agency business services. They actually serve as our finance manager. So myself and Chair are working in coordination with them to get all the things lined up, but OMES actually serves as our finance manager. And so these information has come from them and ready for your presentation and approval. And I think you're gonna need to click it for us. Just say it's on. There we go. Okay. So this is a quick overview of our, again, as the status of our finances for May 31st through May 31st of 2026. The blue column is our total budget for the year, which is 6.1 million. And if you do recall or remember from our budget that I presented last time, this is actually $76,000 higher than our budget last year. We moved some existing cash from our existing cash and moved it into our budget to cover some expenses, particularly related to our database system. So if you'll compare this report to last month, it is $76,000 higher. The green column shows our expenses and encumbrances year to date. So we're at 5.6. I take that back. I'm sorry. Our budget year to date is 5.6. Then the orange column represents our expenditures, encumbrances, which is 5.3, which as of May 31st puts us at 87% of our expenditures. And we'll still have a handful more months to pay off all of our 2026 expenses. And so we will be at 100% over the next few months. And just as a reminder, this state fiscal year ends June 31st, or June 30th, which is here in a few days. The bottom box just gives a reflection of what our total budget is. We have 3.1 million from state appropriations, 1.5 million from our 200 fund. It says 20,000 there, and that's technically it, but we refer to it as 200 fund. And then 1.4 million of our 210 fund. So that's the breakup. That's the makeup of what our appropriation dollars are.
Hey, Mark.
Yes.
Before you go on, just so for the new people, on that slide, the revolving fund, that 200 fund he's talking about, those are all contracts with other state agencies for the most part. We also have a contract with OPSR upstairs, but that's mental health, DHS. Is that it?
There are 7 sources, and I probably should have included them here, but when I go over our budget in a moment.
Oh, sorry, you're gonna see it.
But we have 7 different sources that provide into the.
But my point being is we're heavily reliant upon partners to make that 6.1. It's very misleading. What we get from the state to do our work is 3.1, and we have to beg from the rest of you to help us accomplish that. So I just want to be very clear. And then that bottom, which looks like a lot of money too, 1.4, that's all the money for the freestanding teams. So again, it makes it look like we have, oh my gosh, their budget has gone up so much. Well, that's because mostly everyone in this agency, predominantly PNC, but not only PNC, the Office of Planning and Coordination, have gone out and, begged from friends to get support. So I just want to point that out. Sorry, I don't mean to interrupt, but I think that's a very important slide when you understand what those 3 categories are. So if anybody says, well, their budgets have gone up, so what are they complaining about? I just point them to the appropriations part, because that's the part that should be funding our core services. So, okay, enough of that.
This next slide shows our utilization broken down by our variety of departments within the OCCY. And the annual budget, year-to-date budget and the expenses, which then reflect at the bottom our total usage of 87.52%. I do want to point out, you'll see on the second or the third row that Children's Endowment Fund, and I shared with us at the last meeting. That's a department that we previously had appropriation or payroll expenses there, but we've decided to move all that to our Office of Planning and Coordination. But at the beginning of the year, we didn't have those numbers right. So they were pulling money out of that department at 71,000 for the first few months of the year. But actually it comes out of Department 42. So that's why that looks a little bit.
Hey, Mark, can I ask a quick question? You by chance have a breakdown of this? So all the departments showing, on the side there, you've got the budget, the annual budget for each one. Do you have a breakdown showing of that number on the budget? How much of that is state appropriations?
Don't have it in front of me, but
That's okay.
on my next agenda item number 5, I'm going to go over the budget for this coming year, which numbers will be different because this is not what, but it will have that breakdown. It'll give you a comparison. But on average, when you'll see 88% of our appropriations goes straight towards payroll for fiscal year 27. So the number's somewhat similar this year, but I don't have that number
That's
right
okay.
in front of me right
I
now.
was just curious how much of each of those departments, you know, even a percentage, how much of that total budget for that department was state appropriations versus the pulled together dollars, you know, but we can look at that.
Yeah, when we go over the budget, I'll give you a little bit better picture. I still don't have it broken down by department in the presentation, but I have that and share that easily. So I have it in front of me. Sorry.
That's okay.
So here's the same information broken down by expense category. And this covers all of our variety of departments. And you'll see, again, the annual budget, expenses, and then the percentage at this point. And I will point out a few things that look pretty unusual. About halfway down, you see 533 maintenance and repair, that's 588%. While that percentage is outrageous, the dollar amount is very minimal. We budgeted $1,200 for maintenance and repairs this year, and we've spent $7,000. And I shared this with you last time, and it's largely for this system right here. Our AV system broke down about 3 different ways so far in this fiscal year. This system, when we moved into this building, which was right at 6 years ago, brand new state of the art, but apparently 6 years is very old for this stuff. So we've replaced a variety of items in this room. So that's put us at $7,000 that we didn't expect. So our 588% is wasn't fully planned for, but the dollar amounts aren't that great. Also down 542 and 552, those were some expenses that we spent higher than what we budgeted at the start of the year. But again, the dollar amounts aren't significant, even though the percentage is pretty high. But it still keeps us well within our budgetary or our expenses for this current year. So again, our total expenditures for this year is up to May 31st is 87%. This is our cash balances. We have currently 4 different funds. The 195 is fiscal year 25 appropriations. So as of May 31st, we have $273,000. And all that money has to be moved out by November of this current year, and we have a plan to make that happen. 196 is our fiscal year 26 appropriations, and as of now, we have $572,000 there. Our 200 fund, which is also 20,000 on the other slide, is our revolving fund, and this is again where all of our partnerships and all of our reimbursements, we have $298,000 in there. And then our 210 fund, which is the CAMTA. This is the money that the FSMDTs receive. We receive from DHS for that work. Is $161,000, which gives us a current total cash balance as of May 31st is $1.3 million. All the details of all these reports were shared in your packet. So probably about 25 pages of financials if you want to review those. If you have any specific questions, please come back to us and we will let OMS help you figure that out or help us understand your questions. So all 3 of those reports are in there. And then there's just some activities. Chair Taylor has come on board as our business manager. This will be her last time serving in this capacity for you during this meeting. She has come on board to help us with a variety of things. She's hit the ground running, requisitions, purchase orders, change orders, processing all of our invoices that come through our office, and then helping us transition from fiscal year 26 to 27. All kinds of contracts, renewals, purchase orders, all kinds of things can come along. And then the second item is we've been working furiously on our budget. All of our budget documents are due July 1st. And so that's what we'll talk about here momentarily. But we've definitely been busy with getting things, keeping them in line. That is the presentation of the.
Can I
Yes.
throw one more thing in? Mark brings this up often and it's super important to remember. So when we were looking at the cash screen, everything we do for the most part, with the exception of the FSMDT money, the freestanding money, it's all reimbursable. So we have to pay up front. So we always have to have some cash reserve so that we can do our activities and then seek payment. And for those of you who are vendors or contractors with the state of Oklahoma, you know how exceedingly frustrating it is when you're waiting to get paid. We're in the same boat. So just know that. So we have to have money so that we can pay you. It's almost like, you know, all these steps, right? So just wanted to be clear that you hopefully will never see a zero available cash balance, even though you may think like prudently, well, they've spent all their money. That would make sense. Well, then we'd be in dire straits because we couldn't pay you or other vendors and contractors. So I just want you to be aware. So if you're like, that seems like a lot, we need it. We need every bit of it so that we can pay our bills and then get you paid. So, okay. I just wanted to bring that up because you bring that up to me every time we meet when I'm like, that seems like a lot. And he's like, it's not enough.
Other questions? I will present this to you all for your review and approval.
Motion to approve.
Report be approved.
Second.
Motion and a second. Any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks.
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip.
Yes.
All right, thank you. Next on the agenda is agenda item number 5, discussion of possible vote regarding the OCCY 2027 state fiscal year budget. And I'll turn it back over to you, Mark.
Thank you. So our fiscal year begins July 1st. So we had to have all of our, we submitted this to OMS already, but they're aware that the commission must approve our annual budget according to Title 10 OS 601.5. This body must approve the annual budget for the coming year. So that's what this presentation and review is for. And we will get things finalized after today's meeting and get them formally submitted to OMS for approval, following any feedback or decisions that you all make today.
Sometimes they move it forward.
What's that?
Yeah, just click.
There, okay, all right. So again, this is our proposed budget for fiscal year 27, because it's July 31st or July 1st. So our total proposal is $5.3 million. So you'll see the pie chart. This is the breakdown of what those funds are. And as Director Jacoby spoke of, you'll see how we acquire them this coming year. So 197 is our fiscal year 27 budget, which is just over $3 million. And I'm gonna break down some of this information a little bit further after that. And then below that is our 20,000 or 200 fund, which lists the 7 categories where those funds come from. And that is 16% of our budget, as Director Jacoby pointed out, which is a pretty good chunk. So we have partnerships to receive these funds, but almost all of these are reimbursable, as Director pointed out. We have to expend all of these funds first, and then once we submit invoices to our partners, then we get paid back. So that's why we always have to have available cash to pay for that for the coming year. But we project that once we make expenses and perform services, we will get all these funds back throughout this year. The 210 fund is our CAMTA, which is 26.5% of our budget. There's a slight difference in that this year. Well, I'll cover that in a moment. But 26.5% is our CAMTA funds, and I will go over some details of that. in the next few slides. But that creates our $5.3 million proposed budget for this fiscal year. This slide reflects some changes from last year to this year. As you'll see, and the box up there, our total budget for fiscal year 26 was 6.1 million. And our total budget this year is 5.3 million, which is $813,000 difference. And so I just wanted to make you all aware of why that's the case. In large part, we are fully aware of this ahead of time, so this isn't a surprise to us. So I just want to kind of go over some of those changes. The primary changes that I want to start with first, there was a House Bill 4050, which impacted the state's contributions for state employees' retirement systems, which reduced our budget by our appropriations by $107,000. We have about $194,000 of reduction of a PDG grant, which was fully understandable. It was I don't remember the number of years. Our 5-year agreement expired last year. We've continued that agreement, but just as a reduced rate. So we knew that was coming. So that's a planned reduction. We have $40,000 and $70,000 that we underestimated for our 4E and our CAMTA funds this coming year. And to be honest, we don't know what those amounts are. So we feel it's safer and more prudent to underestimate. We won't find out what the true Title 4E and CAMTA funds are until later in the year. So again, to be prudent, we've under budgeted, and just in case it's not what it was this past year. We have $234,000 that is not included in this carryover or in this budget. In that fiscal year 26, that $6.1 million carryover from the prior year is included in that. So that makes that higher. So our fiscal year 27 budget, we are not able to calculate carryover. So that's $234,000 that we have not projected or anticipated at this point. It may come back into the budget once fiscal year 26 is finished and complete, but we're unable to use that at this point. But that just shows a variance from 26 to 27, a different amount. And then we made some personnel adjustments to some positions of $40,000. This did not directly impact a specific employee, but as we've changed positions, as there were changes within positions, we made some adjustments, which gave us about $40,000 in savings or less expenditures. So those areas right there primarily reflect where the $100,000 reduction came from. On the other side is some of the service adjustments. These are some of the programs that we've done last year that we will not be doing or at a reduced rate this year. And again, most of them are the planned reductions because we knew that PDG money was going to be less this year. So there was some services we were able to do before that we will no longer, or that we do at a reduced rate. Just want to give you a reflection of why the change from 6.1 last year to the 5.3 this coming year. More information about this year's budget. As Chairman Schneider pointed out, our state appropriations is $3 million, and you'll see 88.5% of that goes directly to payroll. And then that leaves 11.5% to cover other administrative costs, which unfortunately is not enough to cover everything that we need for rent, IT, and other required expenses, but we're able to use 345 of that to cover some of those required operational expenses. The 20,000 funds, again, these is $880,000 that comes from our partners and are all reimbursable. We've, as a highlight there, $604,000 are expenses that we have to pay out of available cash because they are reimbursed. They have to expend at least that much projected this year before we'll get that money in return. And then again, I mentioned already that $273,000 of projected 4E is just an estimate. It would depend on how much the kinds of cases that largely OGSO and our volunteers put in this coming year will impact what the true cost is, which we will not know until later in the year. Our 21,000 funds, our 210 funds is 1.5 million. So we have projected 1.23 million to come from CAMTA. These are funds that come from OKDHS based on a statutory formula that come to us. You see that second area, we're able to keep 5% of that for administrative costs, which we project to be about $60,000. But all the rest of that goes straight to us, out to the FSMDTs out into the community. So it's all, we're simply just the pass through other than that 5%. So another adjustment to the budget that we have made this year is that the teams that do not spend all of that money are required to return that back at the end of the year, and they're on a calendar year. So we project that we will receive, based on our last 3 years' estimates, about $110,000 back to us. And technically, this is considered revenue. And then once we get it back, we have to submit it back to DHS, which technically is considered an expense. So it is a revenue and expense, but it's not money we get to touch in any way. It just comes through us onto them, but it has to be reflected into our budget. So we're going to have technically 2 revenue funds. We're going to have FSMDT. DHS giving it to us, teams getting us prior years' money back. So I just want to give you a reflection of, we got 1.2 million from expenses, revenue from DHS and 110,000 revenue from the teams. But it's all money that just flows through us and it doesn't get to touch other than that 5% of the original amount. So of that $5.3 million, this is how we've broken the total of it down by all of our departments. FSMDTs is the largest amount because that $1.2 million is simply going to go through to those teams. And then our PNC is our second largest, and that is all because of our partnerships with other state agencies and other entities. Thankfully for grants and partnerships that Danielle and her team have acquired. In the future, I can break this down by appropriations, 200 fund and 210 fund, so we can see how those funds come from specifically by department.
Yeah, that'd be awesome. I just think it'd be helpful to know of the things that we're tasked with doing statutorily, what appropriations are we getting to actually achieve those goals from the legislature? So I'd kind of like to see that in the future.
That's good. We can break that out by those revenues next time going forward.
Awesome. Thank you.
This is the same amount broken down by expense code. So again, how we're going to expend all this money across all departments for salaries, insurance, and taxes and retirement, and then by the other expense categories. And it's not considerably different than last year, other than the areas of reduction that we've anticipated. But the types of things that we're going to spend it on is not significantly different than what we've done this past year. We don't have enough money to send all of our staff to out-of-state conferences. We have a little bit to send a few folks, but not all agencies. So we have to, for ongoing training and for our employees or employee development, we got to find free local resources and avenues to make that happen. And again, and all those costs are coming from our partnerships, because we don't have much of the state appropriations that cover it. So that's a very quick overview of what our total budget is being proposed for this current year. And again, we'll go into effect July 1st. Questions or comments or suggestions?
Any questions? Okay, hearing no questions. Is there a motion on this item?
Move to approve the 2027 budget as presented.
I'll second.
Any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks.
Yes.
Commissioner Kurt,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Militant,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes, sorry.
All right, thank you so much. Mark, thank you for putting all that together, and it's a lot of work, but we appreciate it. Okay, we'll move on to agenda item number 6, discussion of possible vote to elect the following commission offices. We'll have to, after discussion, we'll have to have 3 separate motions, one for each office, so chairperson, vice chairperson, and secretary. I've been serving in this role for a number of years, and I feel like change is good sometimes. You know, I think there's lots of people in this room with lots of abilities and lots of gifts, and I think that sometimes change is good to have everybody be able to serve in their capacity. So given that, I love being on this commission. I love serving in this role, and I would love to serve on this commission as a member and let somebody else step up to lead. And so I've made some phone calls. I've got a slate of officers I'd like to nominate and then open it up for the floor for discussion and then hopefully action following that discussion. So after some phone calls, I would like to nominate as chairperson, Commissioner Kurth, as vice chairperson, Commissioner Hicks, and as secretary, Commissioner Hall. So is there any discussion around those matters as we move forward?
Quickly.
Do what?
Let's vote quickly.
I would suggest individual motions too for
Okay.
each position.
And those motions, can I make those motions or do those need to be made by?
Probably be better if it came from some of the members, but if
I have visited with those three over the phone and they've indicated that they would be willing to serve, and I really appreciate that.
it would also probably be best if they abstain from voting for themselves too.
Well, I'd make a motion, if that's all right, to to nominate Commissioner Kurth for the chair position.
Second.
We have a motion and a second. Any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks.
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton, Yes. Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes.
Kaylee needs to
Abstain.
vote.
Oh, you
I'm
just
sorry,
didn't call my name.
I'm sorry, Commissioner Kurth,
Abstain.
All right. Thank you so much. Okay, we need a motion on vice chair.
I move that Jason Hicks be appointed as vice chair.
Second.
Motion second. Any further discussion? Hearing none, please call roll.
Commissioner Aaron.
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Abstain.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Abstain.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes.
Thank you. We have one more. Is there a motion on secretary?
I move to.
Someone else wants to do it, that's
I move to appoint Commissioner Hall as secretary.
Second.
Oh, sorry, we have a motion and a second. Any further discussion? Didn't hear the second for a second.
Really okay.
Hearing no further discussion, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Abstain.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes.
Passes. So that is our slate of officers that will take over July 1st. I want to thank the commission for allowing me to serve in this position for several years. I really appreciate the trust in my leadership. It's been a pleasure to work with Director Jacoby and her team. And I'm not going anywhere. I'd like to be very much involved in legislative committee and all the, anything you need, anything that you all need. So I just want to say I appreciate this body allowing me to serve in this position. It's been a good journey. So, okay, I look forward. Thank you all new officers for stepping up. I really appreciate it. Excited about the new slate and excited about the work we'll be able to do in the next fiscal year. Okay, moving on to agenda item number 7, discussion and possible action regarding amendment to the 2026 Child Death Review Board recommendations, and I will turn it over to Elizabeth Duck.
Good morning, I'm Liz Kopp, and I'm Child Death Review Board Program Manager, presenting the board's 5th annual recommendation. It's gonna take just a moment of your time. There's a lot of inconsistency in the amount of information we receive from suicide investigations. Sometimes we get a lot of information on previous mental health services, the circumstances leading up to the death, self-harm, previous suicide attempts, all that. All too often, we do not get any of that information. Sometimes we don't get even the information leading up to the death. So it is recommended that a multidisciplinary work group be convened to develop a standardized suicide death investigation form for use by law enforcement and or death investigators from the medical examiner's office. The group should include representatives from law enforcement, medical examiners, behavioral health, public health, and social services to ensure a comprehensive and practical design. The form should capture key information, including medical and mental health history, social context, and known risk factors while remaining feasible for field use. This effort aims to improve the quality and consistency of suicide death data to better inform prevention strategies.
Questions? Okay. Hearing no questions, do we need a?
Need a vote to add it to the recommendation.
Okay.
I'll move to add it to the recommendation.
Second.
A motion second, any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tooley, Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes.
Thank you. Next on the agenda is agenda item number 8, discussion and possible vote regarding annual performance review for the executive director Annette Jacoby, including but not limited to possible salary change. So need a motion to enter into executive session.
So moved.
Motion and a second. Any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks.
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tooley,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes.
Great, thank you. And I would like to ask for Ty to come into executive session with us if that's no objections by the.
Mr. Chair, I make a motion that we return into regular session.
Motion?
Second.
Motion and a second, no discussion. Please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks.
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tooley,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Yes.
I'd just quickly like to make the announcement that the board only discussed agenda item number 8, an executive session, and no votes or actions were taken. Thank you.
Thank you. Okay, agenda item 13C. Or I'm sorry, 8C.
It's like, wait.
At this time, I would like to make a motion that we increase the salary of the executive director position to $130,000 In addition, authorize the Personnel Committee to complete their review.
Motion, is there a second?
Second.
Motion and a second. Any further discussion? Hearing none, please call roll.
Commissioner Aaron,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Malone Tully,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Same.
Commissioner Schneider,
Yes.
Judge Warren,
Yes.
Commissioner Whip,
Abstain.
Okay, motion passes. Thank you. Next on the agenda, we will move back to item number 11, presentation on the 2026 Kids Count Oklahoma. And I'll turn it over to Jill Minneke.
Yeah, hi.
Thank you. Start the long way.
It'll be us and Carly, so
Yes.
yeah, thank you.
Appreciate your patience with us.
Yes. You had it pulled up earlier. So, yeah. Oh. Just trying to figure out. Hey. Let's see if I can, you know which ones.
Yeah, it's no purpose of the
Oh. There we go. And full screen? Yeah, let me go ahead and try to share that really quick. It was not. I have it wrong. All right. We wouldn't do that to you. Everything's probably fine. All right. So hi, everybody. My name is Jill. I am a policy analyst at Oklahoma Policy Institute. I work on child well-being and youth justice, which means I specialize in all things kids. So glad I'm in the right place. I worked in child welfare as a family preservation specialist before I was in this role. And I just saw a lot of the barriers that families face, a lot of things that you probably discuss in this meeting all the time, that we're going to talk about in this presentation today. There are policy decisions that go into a lot of the things that we are going to talk about. And yeah, I'll pass it to Carly to introduce herself.
Yeah. Hi, my name is Carly Putnam. I don't think I've talked to this group before. I am the policy director and also Kids Count coordinator at OK Policy. Oklahoma has been the Kids Count grantee in Oklahoma since 2018. And every topic that we work on, from housing to criminal justice to budget and taxes, essentially comes back to whether we are setting Oklahoma children and families up to thrive. I was also our healthcare specialist for 7 years. So you'll hear that leach into the presentation a little bit. We're also going to be covering a lot of information in a very compressed block of time. As I think you all know, we could make this presentation last several days. So there's stuff that we simply are not going to be able to cover. If you have questions towards the end, please ask them or follow up with us via email. Or just talk to us. That works too. So every year, the Annie EKC Foundation, with state and other partners, publishes a child well-being index tracking 16 indicators across 4 domains: economic well-being, health, education, and family and community, for all US states and territories. And these metrics help to provide a snapshot of how children and families are doing in the US. The 2026 Kids Count Data Book contains data from 2024, which is the most recent clean, solid data available. But this year, for the first time, Casey created a longitudinal view tracking indicators going back to 2019. And this helps us understand when a state improves, if that state is actually doing better or if other states are just getting worse. Hypothetically. In the 2026 Kids Count rankings, Oklahoma ranked 44th overall. The last time that we were out of the 40s was in 2017. Broken down, it's not all doom and gloom. This year we ranked 30th in economic well-being, 37th in health, 48th in education, and 43rd in family and community. These are measures that can be improved on, but like Jill said, they're measures that they're policy measures, generational effort, and they also take investment. So economic well-being fundamentally means, do Oklahoma kids have the necessary environment and resources to grow into productive and prepared adults? Broadly speaking, the answer is no, except for that baby who knows screens, understands spreadsheets better than I ever will. Oklahoma ranked 30th out of all 50 states for economic well-being. By Oklahoma standards, for those of us who are used to seeing a list of state rankings and immediately jumping to the end, to look for Oklahoma, 30th is pretty good. But I want to note that the state progress on the 4 indicators since 2019 has been kind of a wash, and the outcomes are still not especially good. 1 in 5 Oklahoma kids lives in poverty. 1 in 4 kids live in households where parents are putting 30% or more of their income into housing. Between 1 in 4 and 1 in 3 kids have parents without stable employment. This isn't great for kids, right? This means high levels of household stress. It means housing instability. It means frequent inability to save for a minor emergency or a major emergency. It means inability at times to purchase necessities like shoes and toilet paper and food. So I would argue that despite the fact that we're doing okay rankings wise, Oklahoma isn't actually doing particularly well. 20 other states are just doing worse. To dig into this further, more kids are poor in Oklahoma than elsewhere. In the same way that people who are homeless need homes, people who are in poverty need money. There's a lot of ways we can do that. Oklahoma uses the federal minimum wage, which is $7.25. You may have heard there was an election recently on this topic. Regardless of the turnout of the election, the situation for Oklahoma families today is the same as it was. And it's true that relatively few Oklahomans, about 17,000 to earn $7.25 an hour. But many more still aren't making enough to get by. The 1 in 5 kids who live in poverty, the 1 in 4 whose parents are putting 1/3 of their paychecks to housing, the 27% whose parents don't have steady employment are not getting anywhere near that top line of a living wage. We also see significant variation of incomes within the state by race and ethnicity. This chart shows median incomes broken out by racial and ethnic group. So American Indian is in green, Asian Pacific Islander is in red, Black African American is in blue, Hispanic or Latinx is in orange, non-Hispanic white in purple, 2 or more races in brown, and then the total over on the end is in teal. So in 2023, which is what this data is from, for non-Hispanic white families, which you can see in purple, the median income was $89,000. Does this mean everyone is making $89,000? No, not even a little bit. But on net, white families are significantly outperforming most other racial and ethnic groups. It's 40% more than the median income for Hispanic or Latino family, which is the orange bar. It's more than 50% more than the median income for Black households, which is the blue bar. There is a stark difference between the financial resources available to white people versus almost any other group. People often have ideas about what poverty looks like, where it's concentrated, what causes it, who it most affects. And this graph shows poverty in people under 18 by county in Oklahoma, with the higher poverty areas in darker orange. And the thing is that it's pretty darn rural, which is something that often doesn't come up in conversations about who's struggling and where and why. Oklahomans are hungry. 1 in 4 Oklahoma kids are food insecure at some point in the prior year. They didn't know where or when or if there would be a next meal. This is where programs like SNAP comes in. SNAP allows low-income families to buy groceries, but legislation passed by Congress in 2025 means that SNAP is less of a lifeline than it used to be. HR 1 means mandatory increasing of bureaucratic barriers and red tape for SNAP enrollees, as well as potentially hundreds of millions of dollars shifted from federal responsibility to state responsibility. States have been trying to prepare for this switchover by becoming much more specific in how they're reviewing applications. So SNAP enrollment in Oklahoma has dropped at least 14% over last year as a result. That's 97,000 people who were getting food assistance last year and are not getting it this year. And to be clear, this doesn't mean that those kids and families are suddenly getting enough to no longer be eligible for SNAP, that they're suddenly getting by. It just means that more Oklahoma children and families don't have the assistance in purchasing food. It's a little bit like if you're in a swimming pool wearing water wings and someone takes your water wings, you haven't immediately learned how to swim. You're just in a pool without the water wings. These are problems and they're fixable. A minimum wage increase is probably passé at this point, but we can modernize existing targeted tax credits to get more cash in hand for Oklahoma households. We can stop doing broad-based income tax credits. They make Oklahoma's tax system more regressive and also starve the budget for essential services and needs. Congress can pause or delay the federal SNAP cost shift to states, which would potentially cost Oklahoma's Department of Human Services up to $250 million. And the state of Oklahoma had refused additional funds from the federal government to help support families with children in summer months when school meals aren't available. They could take that money covering the kids and families who don't live in tribal areas. For about 45% of the state areas that are considered tribal land, Oklahoma's native tribes stepped up and are covering all kids in their areas regardless of tribal citizenship. To switch gears and to continue a car metaphor, being in good health is a little bit like having a car that runs. You don't actually have to think about all the things that can go wrong until something actually goes wrong, and then you may be completely up a creek. And it can be really expensive and really disruptive, and there's not much you can actually do about that in the moment. This is an area where Oklahoma actually hasn't gotten worse since 2019. We're ranked 37th, which is not as bad as some of the other rankings. We split this presentation in half, and I got the two where Oklahoma's in the 30s, and Jill gets the two where Oklahoma's in the 40s. So I'm the optimistic part of this presentation, and she's gonna bring us all down. On two indicators, share of babies that were born at low birth weight and share of children who are uninsured, we have at least stayed stable. Improvement would have been nice. What actually the child insured indicator doesn't show, it goes from 2019 to 2023, is that our child and uninsured rate was 7% from 2021 to 2023, due to the combination of the Medicaid disenrollment freeze during the pandemic and the welcome mat effect on Medicaid expansion. Less fun is our teen and child death rate. It's troubling when you consider that the top causes of death, and I think you have a graph in your packets that says this, among children are first firearms, and then motor vehicle accidents. Guns and cars are an important part of Oklahoma culture. They also kill our kids at pretty high rates. Oklahoma can do better when it comes to getting health care to kids. We're much more restrictive in what family income families can have for their kids to qualify for Medicaid than a lot of other states. So this graph shows the income cutoff for Medicaid coverage, senior care coverage for children with the US average and Oklahoma, both in red. Oklahoma is the one on your right. And you can see that Oklahoma's cutoff is fairly low, meaning that families have to be poorer than families in other states for their kids to qualify for healthcare. In Oklahoma, the children qualify for Medicaid if their family income is less than 210% of poverty, or about $60,000 a year, for one parent with two kids. And as the graph shows, we can do better. And the left side of the graph, it's not just California and Connecticut, although they're there. Alabama's at 310%, Missouri's at 300%, Tennessee's at 300%. These are policy changes that are doable. This graph shows the Medicaid or senior care enrollment by county in parts of the state, and incidentally, the same parts that were shaded darker on that map a couple slides ago. We can see where Medicaid use is most concentrated. In some parts of the state, 1 in 3 people need Medicaid to be able to see a doctor or fill a prescription. As with SNAP, federal legislation is requiring states to create additional barriers to Medicaid coverage, and they're requiring states to do it on a virtually impossible timeline by January of 2027. Work reporting requirements, increased copays for members, and more frequent reterminations are designed to drop Medicaid enrollment, and they will. There are solutions to this. Oklahoma can raise the income cutoff for children on Medicaid. When kids can see a doctor and get access to their prescriptions, they do better. It's actually kind of simple. Congress can also force a pause or a delay in implementation of new federal requirements. Because adults can see a doctor and get the prescriptions they need. They also do better. We have a significant amount of research on this. The state, meanwhile, can adequately fund the healthcare authority at the levels they say they need to implement all of these new changes. The healthcare research powerhouse, KFF, did a recent survey on state readiness, just in preparing for work reporting requirements. And in it, Oklahoma reported no challenges on executing data sharing agreements or establishing system interoperability. The agency felt good about that. It did report challenges on cost to establish data linkages, ongoing costs, insufficient time to implement, and lack of staff capacity. Without sufficient resources, a difficult and painful systems change is going to be more painful and difficult, and not just for the agency, but for the Oklahoma families who rely on Medicaid to get their health care. The state can also build on efforts to continue building relationships with tribal healthcare systems. Those systems are the backbone of healthcare in rural Oklahoma already, including for folks on Medicaid. And as the state wrangles with more work and fewer resources, it is going to have to continue to rely on partners. And those relationships will be reciprocal rather than transactional. And if you'll forgive me for going on a bit about healthcare, like I said, I'm a recovering healthcare policy specialist, so sometimes it just happens. I really wanted to thank Nancy for her comments earlier. I think set up almost everything that we're going to talk about, have talked about, and are going to talk about in this presentation. Having now solved poverty and healthcare in Oklahoma, I'm going to hand this off to Jill, and she's going to do some schooling as she tees up the education slide.
Thank you. So briefly, I want you all to think about what factors contributed to you receiving a quality education if you felt you received one. Was it the topics you covered? Was it your peers? Was it your teachers? The early years of children's lives set the foundation for their lifelong success, and education is foundational to that. You can't be a construction worker if you can't do math. You can't work in fast food if you don't understand some basic science about how a hot stove works. You're also not legally allowed to drive in Oklahoma if you can't read at an 8th grade level. So we need educators to be able to help young people as they move through the public education system. I included a photo here of the teacher walkout in 2018 because this is when we saw the public show up for this need and demand action from lawmakers. And one of the few times in the past 20 years that we've raised revenue in Oklahoma to help support education. So looking at those numbers, you can see that we got worse in every category that they decided to feature here. Not included here is that Oklahomans graduate high school at a rate on par with the national average, but are less likely to venture into higher education, which means that Oklahoma has a ultimately less educated and lower paid workforce. The amount of young children not in school has gotten worse. Math and reading proficiency have fallen. So we're seeing some success on our high school graduation rate. Some we've gotten better in the United States as a whole, but worse in Oklahoma. We also know that there's just really big educational disparities between white, Black, and Hispanic students. We know that the scores that they achieve are also worse than what we see in white students, and that is because we see those outcomes because of historical segregation that communities are still recovering from, especially in the education space, as well as the economic component that we already discussed.
Can I add something?
Yeah,
I'm so
please
sorry.
do.
There's a ton of information available better than we can put on a slide at the Kids Count website. But the slide there shows 2019 and then 2024. We actually improved 2023 to 2024. So we were doing poorly. We continued to we got worse, and then we started getting better again.
Yeah.
And unfortunately, that's not so much shown on the slides as we have them.
Nuance is missed when you look at one year versus the other, but over time, you see some of this move around a little bit. So let's look at decisions that have led us here. Here you see the state funding formula from fiscal year 08 to fiscal year 26. I don't have it updated for fiscal year 27 yet, soon. But what this means is that we haven't seen education funding in nominal dollars is pretty much the same as what it was 20 years ago. But when you adjust for inflation, it's actually much lower. We haven't kept pace with inflation with our education budget, but the share of funding that is in our budget that goes to education has actually gotten smaller too. It was 35.5 in fiscal year 09, and now it is 33.4%. So the share of the budget has also gotten smaller. It doesn't sound like much, 2% difference in the share of funding of our state's budget. However, it's a big difference. It's something that could mean bigger classrooms and fewer teachers. It means reducing extracurricular activities, the things that keep you involved in school and wanting to go back. Using textbooks that are out of date. I can say that from my own experience. I used many textbooks that are out of date. All of these are decisions that contribute to lower academic achievements, and there's only so much resilience that students and teachers can muster to make up for budget shortfalls. So we've also added a public voucher system into this equation, which means that there's even less revenue available for us to put toward public schools. So there are solutions. Like many problems, there are solutions. More funding isn't directly correlated with student achievement, and I will concede that, but a shortfall of money has its negative consequences. We've seen that play out in our rankings here as a state, and we have to prioritize the people that our education system is meant to help function, our teachers. So making sure that their benefits are competitive with other states and keep up with inflation. And we also need to modernize how much money we make available to fund schools. Like I said, it hasn't kept pace with inflation for the last 20 years. So now for family and community, we rank 43rd. In the handout, you'll see those statistics lined out. But I want you to think about what it means for you to have a support system around you. Are your loved ones your biggest cheerleaders? Was it easy for them? Did you see the challenges they faced along the way? We know that children who live in supportive communities have stronger personal connections, they realize higher academic and non-academic achievements, but we also don't always consider the structures and challenges in place that might make realizing higher achievements, education, or a job more difficult or impossible when living in a fight or flight state. In Oklahoma, we have really high levels of ACEs, or adverse childhood experiences, or parental incarceration, which this group has a group to address. Many who would like to remain connected to their families and communities are unable to do so. So we have higher levels of violent crime than the US average, and many youth are still subject to a justice and child welfare system that more often favors punishment over rehabilitation. Incarceration also frequently leads to the removal of parents from the home. Estimated 26,000 Oklahoma children have a parent in prison. Parental incarceration also takes wage earners out of the home and important emotional supports in their families and communities. And that's why we rank 43rd in family and community. So let's dig in a little deeper. We know what ACEs are. I would hope that you all know what ACEs are. But in case you don't, ACEs, adverse childhood experiences, which are potentially traumatic events in childhood. We have different types of ACEs. Some can stem from abuse or neglect, but also can stem from household challenges like substance misuse, mental illness. One thing that's not on here is like home displacement. If you experience homelessness as a child, that's an ACE. Also parental incarceration, divorce or separation. Also a family member experiencing mental health episodes is considered an ACE. So, in Oklahoma, I need to go back a second. In Oklahoma, around 21.5% of children have 2 or more ACEs, which is higher than our national average, which comes into play when we look at the systems we use to respond to child maltreatment and abuse. So in our child welfare system, we have around 6,500 kids in out-of-home placements last year. And our child maltreatment rate is 14 substantiated cases per 1,000 children, which is a number that's been going down. Maltreatment doesn't necessarily mean child abuse. Often a substantiated case of maltreatment is just a lack of resources to be able to meet that kid's needs. And often a substantiated case of maltreatment can mean legal consequences or even removal from the home. We also know that families that are Black, Latina, or Indigenous are disproportionately likely to be subject to a child welfare investigation. And removing children of color from their homes has been used as a tool for forced assimilation and colonialism. So with struggling families afraid to seek help they need from our child maltreatment system, it prevents people from seeking help that they need. So conditions that could ultimately lead to a child welfare investigation outside of child abuse, like nutritious food, a responsible adult being present at all times, or a child showing up to school every day, are all things that can be solved without removing the child from the home. But what makes this worse is that there's no single path for youth to turn to delinquency, but child welfare involvement can ultimately mean that more youth are to become involved in the justice system. So at OK Policy, we produce a report every 2 years on the state of the youth justice system by collaborating with our state's Office of Juvenile Affairs. Shout out. Thank you guys for sharing data. We try to create a report that puts it in a digestible format so a layperson can read and understand what's going on in our youth justice system. Highly recommend checking it out, and it's not just because I wrote it. So, I wanted to give an overview of how our youth justice system works. This is imperfect. If you want to know more how this works in detail, I would ask Hannah or Shell. You would probably be able to give a better explanation than me. But first is Intercept Zero, which is basically all we do to prevent youth from going into the system, from child welfare to youth services, and also mental health care. This is a time when a referral is used, which is the term for when an entity decides that a child is in need of intervention by OJA. So then we have Intercept 1, which is when law enforcement gets involved. Not every referral needs law enforcement involvement to happen. So sometimes you'll see parents or teachers make a referral for their child, but more often than not, it starts with law enforcement. So that's at Intercept 1. Then Intercept 2 is where more consequences come into play in the court system. We also see adjudication at Intercept 3, which is the term for when the court determines that this kid is guilty. Those all come into play in a minute. So I just wanted to give you some dictionary definitions. So let's see how the referrals and adjudications play out in our youth justice system. So what you're looking at is 2018 data, and I'll show you more current data in a second. But what we see on this graph is yellow is a percentage of the state's total population, while red and blue are relative to total referrals and adjudications. This data is from 2018. We'll look at 2023 in a moment. We don't have a census other category as well. It's just how the data was given to us. So we can see that white youth in Oklahoma do make up a majority of the state's population, as well as the youth justice system. But say our justice system were perfectly fair, which is, hard to make happen. However, we would be seeing a relatively same rate of participation at each stage of the system, whether it be referral or adjudication. If it were completely fair, each of these bars would be flat. But as you can see, you can look at American Indian or Alaska Native, or for Black youth, you see that those bars get higher. So higher incidence of referrals in the state's general population and higher incidence of adjudications. What does that mean? It means that Black youth and American Indian youth in 2018 were disproportionately likely to be given a referral into the youth justice system or an adjudication, or legal consequences. So I want you to focus on the middle section right here, as we look at 2023 and see how that changes. Pretty weird, huh? So the reason for that is in 2020, there was a big Supreme Court decision called McGirt v. Oklahoma, and tribal jurisdictions were able to take control of this process. They are able to handle programming for referrals and court adjudications. So I think, and I can't prove this, but as a result, we've been seeing fewer Native youth being put into this system. However, going back, looking at Black youth, you can see that the bars have gotten a lot higher. So we're seeing Black youth being even more disproportionately likely to become involved in the system. Black youth make up less than 1 in 10 of the state's population, but over 23 to 30% of referrals every year and 36% of adjudications. So what can we do to fix this? Well, we don't have a minimum age of adjudication in Oklahoma, for one. You can be as young as 7 and be referred and adjudicated in our youth justice system, which doesn't align with what we know about child development. We could also increase pre-arrest community supports for parents and youth. Like I talked about, some parents are too afraid to ask for help. And so we need to find ways to give help to them before they get in trouble. And also increasing availability of mental health supports and trauma-informed care. So that is our presentation of Kids Count. We have solutions to these problems, and I think that this is a group that is very dedicated to making changes in our state. If you have more questions at this time, please feel free to ask. We went through things really fast, but thank you all.
Appreciate the presentation. Are there any questions?
That was a great graph of the process.
Awesome.
It's very difficult to describe, especially visually, all the different loops and going back, but that was phenomenal. So great job.
Feel free to use it. It's on our website. Any other questions?
Compliments.
Or compliments. I take compliments.
I know we've got a lot to get through.
Yeah, thank you.
Thank you so much.
So sorry.
Okay, next we have on our agenda item number 8, presentation from Foster Youth Matters and Foster Parent Voices update. And I'll turn it over to Tina Williams.
All right, actually, I'm Stephanie Miller. Chania Williams is over here. I will be kind of doing a lot of the presentation, although I'm sure there will be some added commentary as I go on. As I said, my name is Stephanie Miller. I am currently the foster care ombudsman in the Office of Client Advocacy. For a lot of years, we were over at DHS, and I'm going to talk about this here a little more, but we are a small but mighty division. And so I know a lot of you may not have heard of us. So we wanted to kind of give you an overview of who we are and then just briefly discuss the grievance programs that we oversee in with our partnership with OJSO. So it's not. Oh, there it goes. Okay. So the Office of Client Advocacy, we are there to promote this safety and independence of basically Oklahoma's most vulnerable folks. Our division covers vulnerable adults, or our DDS clients, developmental disability services clients. So those are mostly adults, but we do have some that are children that are served through that program. We also have advocates for those DDS clients. They go into courtrooms, they will sit in multidisciplinary team meetings. They do several things to make sure that that client's voice is heard, especially for those that, may not be able to verbally speak for themselves. They make sure that they're getting the proper services, make sure that the DDS case managers are properly fulfilling their case plans and that kind of thing. We also have another division within our unit that does investigations. Our investigations unit goes into, we have a kids division, which does go into some OJA facilities, basically facilities that are contracted with DHS. So these could be, I know Lions Meadow of Hope has a facility, and then also any sort of private agencies such as BIOS, that kind of thing. And then our last division within our office is our grievance and intake division. Our intake partners, they basically take all the incoming referrals regarding our vulnerable adults and kids, and then they process them out from there. And as I said, we were at DHS, I think we started in the 80s, or was it the 80s? Yes, when OCCY was developed. Legislation was passed in 2024, and they moved us over to the State Department of Health, where we've been for almost 2 years now. it's been a great move. OSDH has accepted us with open arms, and it's been a great partnership. Since we moved over, just wanted to give you an overview of some changes. We did do some restructuring within our office. One thing that we did do was consolidate all of our grievance programs. Before the move, I was the program field representative for foster parents, and we were in our own area with the foster care ombudsman. And then the youth grievance program and the DDS grievance programs were on another side with a different director. So once, about a year ago, we made that change and made the restructure so that grievance and intake are all together, and all three grievance programs are now under one, I guess, shelter, you could say. And then within this last year, we also have developed a shared database with OJSO. They took the lead and made a great new website for folks to file complaints. It's a lot more visually appealing than what we'd had before. They really went over and above, over the top to help us out. They connected with us to make sure that we had the things that we needed to process our grievances in a quick and efficient manner. So I just wanted to introduce a couple of our staff because they do the majority of the work, and I wanted you to see their faces. But first, Chania is our programs administrator for grievance and intake. And then I oversee all three grievance programs and do the concurrent role as a foster care ombudsman. Just to give you a bit of a background, I was a foster parent for 6 years, and then we adopted 2. So I have that piece, and then I did the program field representative job for 5 years up until last year. So there's some lived experience there. So when we get people calling and asking questions, not only myself, but Nataki over here, she is our new program field representative for foster parents. Nataki is also a former foster parent. Her and I both have adopted kids, and they're the same age. So we are talking a lot about our pubescent boys right now, but and what, the daily drama, I guess, that is involved. And Nataki also was a former investigator on our investigations team into the kids' facilities. And then she is also a former child welfare specialist. Christy joined us also last fall, and she is the program field representative for our foster youth. And we'll go into that a little bit more about the youth and who can file on their behalf. And then Tamara Winters could not be with us here today. She's on leave, but she handles our DDS clientele. So a lot of our programs are governed by statute. So we have 3 areas, like we said. We serve children being served by child welfare and congregate care facilities. We do help foster parents, and then as I said earlier, the vulnerable adults receiving services through DDS. This is just, I'm not going to read all this. We monitor and we maintain, obviously, those grievance programs in conjunction with OJSO. We will also oversee policy. So when a new facility is opened, or say a new home health agency, that kind of thing that works with our DDS clients, they do have to go through an approval process regarding their grievance system. So they are required to have those. And then they are also required to have a local grievance coordinator, and each facility must have their local grievance coordinator go through training on a yearly basis. And then we will provide other trainings. Back in 2014, there was legislation passed with a foster parent bill of rights. And this was in order to give foster parents a voice where they felt previously there had not been. And it was done by looking at other states, what their what they had done. So any foster parent that believes that their rights have been violated, they can file a complaint through our program. And there are some parameters, there are things that we cannot take, and I'll discuss that here in a few minutes. But so if a foster parent, if you come across a foster parent and they feel like, anything that has to do with child welfare they are not happy about that, they can contact us. Contacting us does not mean that they're filing a grievance. We do a lot of education beforehand. I just talked to a parent yesterday. She was having a hard time with her worker because she wasn't responding. And so we kind of go through their options. A lot of times we do encourage them to, let's try doing something a little less formal. You have every right to file a grievance, but maybe try reaching out to the supervisor. So we do try to, mitigate where we, so that we're not getting a lot of frivolous stuff. But at the same time, we make sure that they know that they do have that right. Some examples, we get some very simple ones like, the communication thing is, we get a lot. But, we can get some that are so complex that we have to even divide it out where they're having issues with foster care as far as getting their homes approved. And then they're having it, they don't agree with a placement decision. They can sometimes become multiple issues. But things like, I'm not getting communicated with in a timely way, or for a long time, we would get grievances regarding delays in approvals of foster homes. And we would see this a lot in kinship homes where, somebody would come in and say, well, you'll get back pay from day one. Well, what they don't understand is that a lot of that money that is paid out for monthly maintenance payments is federal money. So there are certain criteria that have to be met. So, but since with the new kinship directives that have come down within the last couple of years, we've seen that go down quite a bit. So that has been great. And then we also take grievances for those folks that may be foster parents with an agency. So I did go through an agency back when I was fostering. And so if they have an issue with that agency, we will route their grievance for them and kind of oversee that process. So we make sure they're heard. This information here is from 2023. Most of the time, and I'll go through this here in a minute, but when a grievance comes in, we don't necessarily automatically process it. Like I said, there are statutes that govern what we can take. But 77% of the time, we are able to get those through. And then 74% of the time, we're able to get those knocked out at the lowest level. So we don't kind of clog up the system. And then another thing that we do is we will do monthly online trainings. This is something my predecessor started back in 2020 when, we all had to work from home. And we do an online training on topics to kind of help foster parents in their relationship with child welfare. So as a foster parent, I remember going through training, and some of you, even in professional jobs, you'll sit in classrooms and you get all this book information, but until you actually live that information doesn't always make sense. So this gives us another chance to kind of go back and re-educate in some ways. One issue that we found that a lot of foster parents were not understanding was the safety issue and the safety thresholds that have to be crossed or met. And so Dawn developed a training on safety. So now, when a foster parent is upset because a birth parent doesn't have a kid in a properly secured child seat, which we all know is unsafe. But as far as, whether or not that would keep a child from going home is not the issue. So we do a lot of education in that. So we'll talk about, the court system. A lot of foster parents have not been in the court system and they don't understand. We'll talk about their rights as foster parents and the grievance process. And then, like I said, we'll talk about safety risk versus, safety issues. Our foster youth grievance program was developed back in 2018. It is governed by a little different measures. As a foster parent, to file agreements, you have to be a certified foster parent in the state of Oklahoma, or at least be in the process. So we can't have, I can't have somebody file on a foster parent's behalf. They can't do that. But as far as children, a foster youth, as long as they're being served by child welfare, anyone can file a grievance on a child's behalf. Now, does that mean that we can give them all the information? Not always. So a teacher, a friend, a neighbor can file a grievance on their behalf. Depending on the situation, though, we may not be able to give them all the information that they may want to know because they don't have any right, obviously, to that information due to confidentiality. One thing that, since Chrissy's been on board, one thing we've really made a point is if a child is, within a reasonable age, 10, 11, 12, and somebody files on their behalf, we do go to the child and say, someone has filed a grievance on your behalf. Do you want us to go forward with this? So it depends on the situation again, and it is kind of a case by case basis. But, for example, a few months back, we had some family members file a grievance on a child's behalf saying that child wanted to be placed in their home. Well, when Christy called and talked to them, the child did not want to be moved at all and was fearful of that family member. And so, and the great thing about that too, we were also able to connect that child, they talk with the district directors. And so it's been great to see, we've had a few of them come back say, I'm so glad that you sent this to us. I got to know the kid. They kind of get back into that day to day, getting to know what the kids are dealing with. So that's been great. We get quite a few more grievances on the youth side because we do get grievances from facilities. So they range anywhere from I don't like the food. And a lot of those are settled in-house, and that's where the grievance policies that we talked about earlier that we approve. Most of these facilities have an in-house grievance system that they can do, and but if it's dealing with a child welfare worker or a child welfare employee, it comes to us. But we've got, we get some that are regular filers that they don't like the way somebody looked at them last week. And those are considered, those are informal problem resolutions. So most of our grievances do have to do with Oklahoma Human Services, but we do have a good number that about 32 to 35% that come from the facilities. And then just a brief, I know we do have some overlap when we do have a child that's in child welfare custody that does receive DDS services. These are complaints usually regarding in-home care. That kind of thing is what our DDS grievance system is about. Most of those get routed through, DDS, but every once in a while we'll have a crossover and we'll have to move it through child welfare. And there's just kind of some examples of, we have our regular filers on that side too. We have a friend at one facility that he really does file quite a bit because he doesn't like the way somebody looked at him. But, we make sure that an advocate always meets with them, discusses the issue with them, and makes sure that their problem has been solved. I just wanted to briefly go through the grievance process. There is a lot that goes on in between here, but when we first get the grievance, they come through the OGSO, Foster Youth Matters, and Foster Parent Voices websites typically. Sometimes we get email or phone calls, but we like to route them through here so that we have a grievance number assigned and that kind of thing. Once we go through what they talk through, a lot of times we do a lot of interpretation because especially with foster parents, they'll call and they just dump and they're mad, but they aren't sure why they're mad sometimes. And so we'll do a lot of just kind of one-on-one education and try and narrow down what it is that they're wanting. Sometimes they just want heads to roll. And so, we have to be real clear and say, that's a personal action. We will make sure you get heard, but you're not going to get to find out what happens after due to confidentiality. There are some things that might be considered non-grievable. So if we get a grievance regarding a referral, somebody is mad, we've gotten a few, they're mad because somebody filed a referral on them. I can't take that. Anything regarding usually an investigation or the findings of investigation are off limits. If they're non-grievable, we usually try to make sure that they can find somebody to talk to afterwards. We don't like to just leave people out there. We try to do a warm handoff, either it be to the director's helpline, or a lot of times if it's a court issue, we recommend that they talk to an attorney. And then we also notify OJSO that this wasn't something we could handle, since sometimes they're able to do some things that we can't. Then the grievance is sent on to the appropriate child welfare staff or the child placing agency. Typically, we start at the district director level or the field manager level in foster care. We don't go to supervisors typically, because we have found that a lot of times not only is the issue with the employee, but they've already talked to the supervisor, and they don't feel like they're being heard. So we have found that bare minimum there at district director level tends to make them far enough rooms where the filer feels like they're being heard. If the grievant, whoever's filing, they get to decide whether or not the proposed resolution that child welfare offers is acceptable. So if they find that it's acceptable, we say, great, thank you. They have a letter. We do that in the sense that they will follow through what's in writing. If for some reason they don't agree with what is done, they can elevate it up to 2 times. Usually the next level is typically a deputy director. And then for some reason, deputy directors aren't able to solve that, then it will go to the assistant director, Daniel Herring. Like I said earlier, 70% or 70 to 80% usually do get resolved at a low level. I think last year I sent 2, maybe 3 to Daniel Herring. So our district directors and our regional teams are doing a great job trying to get those resolved. And then last but not least, we do stay on top of these. Statute says that we have to have these closed in 60 days. Sometimes they do go over, and that, we discuss that with OGSO, why certain things may take longer, but we do our best to try to keep those within the 60-day time limit. We also do a few other things. Just to wrap up, we do make site visits to Oklahoma Human Services contract facilities to make sure that they have their grievance programs up and running, and that that those that are in their facilities are able to know how to process or file a grievance. We also oversee, Christy oversees the program review submissions. So those kids' facilities that have a substantiation, there is a review process that is done. And then same with the reconsideration is for our DDS clients. For those workers that may have received a substantiation, there is again, a committee that goes over that. And then we do also do community outreach to the public about just their rights. We will attend different public events. We're not really trying to drum up business, but we just want people to know that they have those rights. This last year, we've kind of been more focused inward as we've restructured. But the plan this next year is to get out more to foster parent groups, to our CPA facilities and that kind of thing, to make sure that we're all on the same page. Any questions?
With regard to grievances on the Foster Children's Bill of Rights, part of that rights is the right to be heard, and I believe it includes communication with attorney, communication with the court. Are those grievances that you also handle, and what does the process look like for that?
Well, the court ones are a little more difficult for us. Yeah, that's really hard, because we really don't have, they're not DHS employees.
Sure.
So, but usually what we will do is we will put them in touch with, when they meet with a district director or speak with them, they'll do what they can to reach out to those attorneys. Sometimes it's the fact that somebody from DHS called as opposed to
Okay.
you know, Aunt Jane is calling, you know. So we do our best. We can't like I said, we can't always
Sure.
succeed, but we do try to help where we can.
And then the other question I had was with regard to youth. You mentioned going directly to them. Do you ever involve the youth's attorneys in those grievances or conversations?
We haven't had a need too much sometimes.
Some attorneys file like on behalf of their client, and so when I send them, like, I'll call the child to go over the proposed resolution. Sometimes their attorney's on that email. But I don't really, when I call the kid, I just kind of let them know, like, hey, you've talked to the district director. Are you okay with it? I did have one kid that was like, I want my attorney to know, and so I made efforts to contact that attorney as much as that attorney would talk to me. But it's not usually part of like the full process. But like I said, it's a case by case.
Yeah.
I have one, just because we've been asked on the delinquent side, is there an anonymous reporting option where there isn't like necessarily hard contact made where it's documented who made? I've been asked that question. I told them that I didn't know they'd have to contact you all, but.
Oh, we don't usually get those because in order for someone to develop a proposed resolution, they need to be able to contact someone. I mean, there is confidentiality in there and where, our records are separate from DHS. They don't have access to our records. Typically a lot of times the workers figure it out, but, if there's an issue where they need to be, if they want to call us and talk to one of us, we can walk through our options and see if there's some way that we can help them.
Okay.
Thank you.
Okay, any other questions?
Thank you.
Thank you so much. I'm gonna skip down to agenda item number 14, presentation, credentialing, post adjudication review board. Myrtle.
Hey Keith, I left my water up there if you need some.
We do like to partner.
Okay.
Ready to go. Well, we're real excited to share kind of our new credentialing effort. Think of it maybe as a certification or maybe just Oklahoma being bona fide, Our PAR boards across the state, we've got about 40 boards all over Oklahoma and about 300 volunteers that meet regularly to review current deprived cases and make recommendations to the judge and the child welfare and to parties to the case. And, our program's been around since the 80s, and we've never done a kind of a certification or credentialing process. And so we started doing that about a year and a half ago. And so just kind of wanted to share that with you real briefly. I think one of the things just kind of walking through this, why have we not done this in the past? I think part of it is the fact that it's not required by statute. Our statutes are kind of meant for these boards to be very much independent citizen review bodies. Local groups kind of looking after this important deprived court process. So, any kind of rules or parameters, we want to be careful with those. And every board is certainly completely different. That's kind of the arguments against not doing it. The arguments for doing it are kind of what are the goals. Is we need to identify areas of needed training and technical assistance. Certainly, Shelby and I, when we go out to the communities and meet with the boards, there's kind of a regular kind of a set of questions we ask every time already. So basically, this credentialing is turning those into more of a formal assessment to find out the same thing. We want to kind of establish, okay, this is the right way of doing things and the wrong way of doing things, and figure out what those minimum standards were. For example, we started, instead of just being a handwritten recommendation that never gets electronically filed at all and handed to the court that way, about 4 years ago now, we started using a database that people enter the recommendations. And so we have our boards are required to enter that information now. And so having that as part of it. And hold those boards to make, needed changes. Certainly something we want to do. So we created an assessment form. It's a scorable form we try to use every kind of question that we would ask into a yes or no, either have it or you don't. And so it has a section for measurement, but also has some qualitative aspects. We always interview the presiding or assigned judge, juvenile judge, when we go do our credentialing. And we talk to the board themselves. And the questions are real complicated. What's working, what's not, and how can we do better? That's all we really want to hear. So I've got some snapshots of the form itself. So you can see kind of the first page there. It's just got the date of the assessment, who did it, what board, who's the chair, who's the judge. And then we're kind of assessing things like, do you have, like in statute, we have to have a, minimum number of members. Do you have do you have 5 members or do you not? Do you meet at least twice a year or do you not? There's a couple of things that are kind of doesn't, are all adjudicated case reviewed at least one every 6 months. That doesn't happen in Oklahoma and Tulsa County. We just can't get to all of them. So that's kind of an NA. But if you're in Tonka County, we do review all the cases. So that does apply. So then that's scored and you take the relevant, things that qualify and then just turn that into a percentage. And then the interview themselves, I mean, these are snapshots from actual reviews. So like, I met with Judge Henderson. He stated he does receive the reports. It's a good group of people. Got a lot of good judge quotes for the last couple of years that I've been doing this. Said the board is knowledgeable people on it. The board interview, kind of what happened there as well. And then come up with kind of, a feedback summary and then some recommendations. So you can see in this one, there's some question, why aren't you meeting in the courthouse anymore? Because when you meet in the courthouse, you can review the case files. When you don't have that option because the court, as you know, the case files do not leave the courthouse. Thing I see all the time is a chair decides because they're the chair, they have to do everything. No, you're the chair, you keep it organized and you delegate. So that comes up a lot. Certainly trying to get them to visit with the district director and know who that is important. So that's just kind of a snapshot. So very specific recommendations come from this, plus a bit of a qualitative piece. So the formal process that's been adopted by our state body, State PAR, is our site reviews are conducted throughout the year. Just to remind you, the entire PARB staff is me full-time, Shelby full-time, and a part-time person that covers Tulsa. So it takes us a while to get across the state. We review them, and it's a 2-year credentialing approval. We score the sheets, we add them up, and then put them into a report. So, and then submit that to the state PARB. And then we kind of present these to you guys as well as kind of what we're proposing now. We do not have this in our rules right now. We're going to move towards trying to do that, where this is more of a qualitative in-house thing we're doing right now. So that's kind of what the report looks like. Just basically what was the raw score, the percentage, any notes, and if they're ready for credentialing or not. So, honestly, in 2025, I went for the easy ones first because I wanted to get the practice. So they were all ready to be credentialed. Got to a lot more in this last year. And we had 3 that we put on a probationary status. We're already moving forward with those, had some changes in Washington County and Fort Pontotoc and Okmulgee County. It's basically they don't have the minimum 5 members. There's nothing else wrong. So I'll use this as a commercial to help promote volunteers for our boards. That's our biggest thing. We need judges that are ready to do this, and a minimum of 5 members who are willing to do that. And so just the benefits so far, I certainly like to visit with the judges anytime I can, by making this kind of almost a mandatory thing that makes sure that we have a relationship, which is great. I do standard board of visitation. It's kind of a bad joke. I always say, if you see me all the time, it's a problem. If you never see me, that's a good thing. With us doing this regular credentialing, that way we're out there on a regular basis all the time. And kind of knowing where to draw a line in the sand. Like I said, these are kind of independent boards, but if you're not using your data, if you don't have the minimum number of people, or you're not returning my phone calls, that's kind of a problem. So a little bit better communication about expectations as well. So that's just really a quick snapshot of what we're doing on this. You all have any questions at 12:30? I'm betting not.
Thank you. Anybody have questions? Thank you for your presentation. Okay, we'll move back to agenda item number, sorry. Sorry. And item 13, Child Death Review Board Review report, and I'll turn it over to Andrew. Oh, and Vivian, sorry.
Everyone, good afternoon. I'm Vivian and this is Andrew. We're going to be presenting on we are interns with CDRB, and so we were also in a master's program, and so we with our internship did our practicum projects with CDRB, and so that's what we're going to be presenting on today.
So the good news is we parsed down our practicum presentations. We'll try and get through this quick. We just want to show you what we've been able to do and what we've made for the board that's really going to help expand their capabilities. All right. So starting out, as interns, we had the opportunity to really get to know the whole process with case review, document requests, even sitting on meetings. And through that, we kind of found that CDRB really didn't have a data collection problem. And in fact, the team had really been working diligently to address a backlog of cases and get caught up with a decade's worth to complete years. Where we did identify a gap was in reporting. So historically, reports were generated based on the year of review rather than year of death. And while that approach is useful for tracking board activity, it makes it really difficult to compare across years, identify trends, and produce the kind of insights that can really support prevention efforts. So as we look further into this, it became clear that cost was also a major barrier. Statistical reports had to be contracted out and often cost thousands of dollars. And those reports only reflected a single year or a single point in time. So it wasn't feasible to go back and generate reports for prior years, and it wasn't practical to update reports as new data became available. So there's two approaches that we kind of took from this. The problem we set out to solve was that kind of what I described, and our goal was to develop tools that allow CDRB to report on their data, enter into the National Fatality Review System, and it would use free and accessible software. That way we could kind of mitigate that cost. So it would make it affordable, feasible, and we could generate reports for historical and future data. And we each kind of took a different approach. So they ended up complementing each other really well. And both of us will kind of show the two sides of the coins we went with to see kind of the whole scope we're able to complete now. For myself, I developed an automated reporting system that's going to generate annual reports from CDRB, and it can produce both a public and an internal version. And it allows us to generate a report for any year just with the click of the button.
And I produced an interactive dashboard using over 9 years of CDRB death data. The dashboard makes the data easier to explore, easier to use, easier to interpret, and easier to understand real-time trends. And because it's fully filterable, reviewers and staff can dig deeper into specific groups, circumstances, or trends without needing to run separate analyses. And so together, our approaches create a more standardized and sustainable reporting process. The automated reports provide consistent year-to-year summaries, while the dashboard allows for interactive exploration across multiple years. And combined, they give the board the kind of insights that they need to guide prevention focused.
Right, cruise right into this. I'll start with kind of introducing my project. When I began this practicum, I talked to Liz and the team and I said, okay, maybe I can just manually go through and make a couple reports for y'all. That way we can chip away at this backlog and start making at least a little headway in this. But when I started working with the data, what I found was there's really an opportunity to build something a lot more useful. And that's because the data set itself was very standardized, very clean, and it kind of gave me an idea. Instead of creating reports one at a time, what I realized was I could use a statistical software, R Markdown, to build an automated reporting system. So this takes the NFR CRS data and generates a complete annual report. Thank you. The system's dynamic, which means that the text, the tables, the figures, they all update automatically based on the year that it's run for. And this standardizes the report structure so that they remain consistent over time without needing to be rebuilt every time. Ultimately, my goal was to transform reporting from something that was labor intensive into a sustainable system that could really turn the child death review data into actionable insights that can support prevention, policy development, and the internal decision. So before I kind of show you what we're working with, I'll just talk about the report structure. So like I said, it's standardized into a specific outline. That way every year is going to be consistent when we run this. So it follows the structure we see here. It begins with an executive summary, that way for y'all, quick footnotes, moving on. But then in the meat and potatoes of it, we go through an introduction, we go through methods, and that helps explain the process, statutes, limitations, and how the data can be used and interpreted. The middle sections summarize kind of our reviewed deaths for each year, the demographic patterns, the important findings, causes of death, and findings like preventability and contributing factors. And then the report also includes an equity and disparities section, which helps identify populations that could be disproportionately affected, and an internal process review section that evaluates how the system itself is functioning. Another feature built in the system is the ability, like I said, to generate two versions of the report. So you can select a filter. With the public version, it's going to be a pretty straightforward summary statistics, be able to run that, we can disseminate that. Or with an internal version, it's going to have a few more graphs, charts, and a whole section that reviews internal metrics. That way we can use it internally and it can support a decision-making process. So the goal with this is that by keeping it standardized, every report's going to be a lot more consistent, and it's going to tell that consistent story from who's affected, what happened, and to where opportunities can exist for prevention and improvement. Click me over. So now I'll get to a little demonstration for you. Rather than cause a lot of headaches with plugging it in, I'm going to show you on my computer. Essentially, I'll just set this at the head of the table. It opens up in R Markdown, and it looks like a big hairy code. It's something like 11,000 lines, and it took me an inordinate amount of time. A lot of copy. But for an end user, essentially all you'd have to do is there's three parameters: the state, the report year, and which version of the report you want. So all someone would have to do is click knit, and it's going to take a while. I've been working the state computer to death, so props to it. It gives me the perfect amount of time to talk through. So right now it's kind of churning and burning through all the info that we've given it in a data file that we download straight from the NFR system. So with that click, the system, gets going. And the big advantage here is that, like I said, the reports don't have to be recreated each year. So with just a click of the button, this is going to generate everything. And that's really helpful because, like I said, one of the problems was that it was hard before to update these reports. That was going to run into more contracted costs. We're going to have to pay more money to get these. So now in cases where more data has become available, it's easy enough to just say, okay, we download the new file and we click a button. So similarly, everything's centrally kind of computed. So whenever we need to update things like contact information or who's in what position, it's simple. It's at the top of the program. It'll be a really quick adjustment, and that's going to automatically adjust it for the whole program. So like I said, kind of the whole goal is that it's going to be automatic. It's going to be easily updated, and it's going to be consistent. So now we'll see. I've been really working on trying to time this so it looks cool. Never quite got it. We're about 99%, almost had it. So it thinks for a little more, and what happens, you get a little pop-up here in Word. It has to think through too. But I give it a lot of grace because what just happened is this is a 57-page document that's now been generated that is going to have everything we need, completely formatted, updated, tables, figures, everything we need for this. So that's my big wow moment. Thank God it works because there are a few chances to iron it out. So, like I said, everything just happened. It processes the data, it performs the analysis, and it compiles it all into a document. That way, going forward, we actually have something we can put out this information. That kind of brings me to what I hope is the impact and sustainability of this. This project transforms that reporting. So rather than something that's manually contracted every year and has to be updated through an extended and really attenuated process, now it's a sustainable system. And instead of building reports one at a time, CDRB now can have a standardized process that will generate that report for any year. So my hope is that this will reduce costs, reduces the time that it takes to get this, and it gives the board a really practical way to maintain their up-to-date information over time. I think most importantly, this is what really helps transform the information collected through the child death review into actionable insights that can support the prevention efforts, inform the policy decisions, and ultimately improve the child safety in Oklahoma. And with that, turn it over to Vivian.
All right, so now I'm going to be shifting into the dashboard that I created using the same data. And like all good things, it started with an idea. My internship with CDRB really opened my eyes to a critical gap in CDRB's abilities. And I wanted to ultimately address this gap, turning raw child death data into something that CDRB staff could easily use and interpret. And so dashboards, like I mentioned, are powerful visual tools. They bring data to life through charts and graphs. They support real-time exploration. They help users recognize patterns and make it easier to communicate those findings. Overall, my goal was to improve data accessibility in order to identify opportunities for prevention and to support informed decision-making. Building the dashboard was an iterative process, and every iteration strengthened the dashboard and made it more useful for those who rely on this data. And before I get into the fun part, the live demonstration, I want to walk you briefly through the structure of the dashboard so you have a sense of how it all fits together. So the dashboard structure, I have several pages. The first page that we'll land on is the overview page. And so that is going to be all of the deaths that CDRB or the Child Death Review Board have reviewed over a 9-year period. And that period is 2013 to 2022. And 2022 represents the most recent complete year of data. And so that's why I chose that time period. The other pages include cause-specific pages, manner-specific pages, infant-specific pages, and all of those that I've talked about so far. They have a demographic section, and so that's going to be your age, sex, race, really the who. And then below that, you're going to have a context-specific section. So all of those specific categories that are mentioned, motor vehicle crashes, drownings, suicides, sleep-related, all of those context-specific information, the circumstances leading to those deaths are described. And then we also have a CDRB review process and timeliness page. So kind of like the metrics in Andrew's report, this is going to be more charts and graphs, more visuals on how we're doing in that process. So I'm going to take over the computer for a second. To show you the dashboard. So, you. Okay, so. Okay, so this is the overview page of the dashboard. You can't really see the title. So I think I saw you.
High floating.
Yeah, okay. I learned something. Okay, so this is the Child Death Review Board dashboard. This is the overview page that I mentioned. Okay, trying to zoom in so y'all can see a little bit better. Like I mentioned, each page has a demographic section. And so this is all of the who. So what was the age of the child? What was their ethnicity? What insurance did they have if it was known? What was their household income level? What region of the state do they represent? Below the demographic section, we have a notes section, and that really details what the data represent and what they don't, how they should be used and how it shouldn't. Also when the data was extracted, so people are aware of how updated the data is. And then at the very bottom, you have the context specific section. Yeah,
And so at the upper right-hand corner of every page, you also have a total reviewed deaths count. And so over that 9-year period, CDRB reviewed nearly 3,000 deaths. And so just to demonstrate the filterability, or if that's a word, the filtering capabilities, we'll just choose a year. Let's do 2014. So it's gonna think, it's gonna load. And you'll see the upper right-hand corner number update as well as all of the graphs. And so for 2014, CDRB reviewed 292 deaths. You can see all of the charts that have updated. The maps look like they don't, but their underlying percentages have. And so just to show you another page, we'll go over to suicide. Just because it's a little bit more full and built out, we have a lot of information that we can gather. But as one of the recommendations that Liz mentioned today, there's a lot that's still unknown. While we do know some, there's still other information that we can gather. So we can look at means of suicide, we can look at their history of self-harm, what life stressors were present in their life. And also the board, the Child Death Review Board's rulings, was the death ultimately preventable? All right, so I'm gonna head back over to the presentation. Sorry, I will let you do it.
It's on page.
All right, yes. All right, there, all right. This one, yeah, okay, thank you. All right, so now that you've seen a little bit of the dashboard and the report, I want to highlight a few of the insights that are now possible using these tools. This is a screenshot of the summary brief that's in your packet. It highlights key findings from that nearly 3,000 reviewed deaths between 2013 and 2022. In this brief, I describe major patterns and trends, identify opportunities for targeted prevention, outline areas where the CDRB review process could be strengthened, and I offer a few recommendations for next steps. For cause-specific patterns, the dashboard allows us to explore details that were previously very difficult to access. For motor vehicle crashes, we can look at restraint use by age and child position in the vehicle. For suicide, we can look at reported life stressors, history of prior attempts, and firearm storage practices. And for sleep-related deaths or infant deaths, we can explore bed sharing patterns, caregiver impairment, and prenatal care history. So overall, this project Overall, this project brought demographic, geographic, and contextual information into one filter-sensitive platform. The dashboard strengthens CDRB's ability to conduct timely, data-informed reviews and supports their mandate to identify prevention opportunities and system gaps. It enhances staff understanding of reviewed deaths, improves communication of findings, and provides a sustainable foundation for ongoing analysis. Now, before we end for today, we'll move into our future directions for CDRB. So these projects have laid the groundwork for future work by establishing a strong and flexible analytic foundation. From a data perspective, that means continuing to improve the completeness and consistency of key variables and expanding documentation of risk factors to support more detailed and meaningful analyses. And one example is the suicide form that we hope to see. And from a reporting perspective, this opens the door to developing multi-year and aggregate reports, as well as targeted topic-specific analyses that can further inform prevention efforts.
And so probably the most exciting thing is we get to talk a little bit about how these are already starting to be put into practice. So I know one thing from the report with the tools, I was able to give the team at SWOSU Rural Health some data for some of their grants to help them support the pack and plays and car seats. And I've also, with the knowledge working with what CDRB does, I've been putting together a review of all the THC ingestion cases for them so that we can hopefully publish something to show that that's an increasing problem.
And then I've been looking to expand dashboard accessibility to CDRB staff and to the Child Death Review Board members. as well as just being able to quickly gather specific data in order to share patterns, disparities, and trends with local partners that are themselves wanting to strengthen awareness and prevention efforts. So overall, this work moves beyond one single project, or two in this case, and begins to establish a sustainable, scalable model for how data can be used to guide decision-making and system improvements long-term.
And that's our goal because we've been excited that together our projects can really move CDRB from simply collecting data to actively using it. And we're hoping that they transform that raw information into actionable insights that can really support the prevention, guide policy, and improve child outcomes across the state. And more importantly, we think that this work can really establish a system and not just a one-time solution or internship with us, but something that we can continue to grow and adapt and use to support decision-making over time. And while this started as a practicum project, I think it really creates the foundation that we can continue to build on as we help increase the analytic capacity and expertise. So this is a great summary. Before we close, we'll take a quick moment just to acknowledge everyone, and then we can move to questions.
So first of all, we want to just thank our faculty mentors at the University of Oklahoma Hudson College of Public Health, particularly those in the biostatistics and epidemiology department. Our training and skills and what we've produced are a direct reflection of their commitment to strengthening public health in Oklahoma. Thank you as well to OCCY and to our CDRB team. And thank you to the board for having us today. And at this time, we're happy to move into questions.
Has there been any discussion about making that dashboard available to the general public at some point in the future?
Annette is nodding back there.
Yes, I'd very much like to do that, like okay to share at the health department. It's a question of, time, money and talent. Yeah, like everything else.
Right.
But yes, I can see this being something like okay to share.
And this is sustainable, whereas they continue to like gather data, it can be easily like integrated into what you already built.
Yep. So that's our hope. Both of ours use files downloaded from what CDRB already uses. We both already started working with the staff as our guinea pigs to say, can I teach you how to use this? And it's gone swimmingly, so.
Well done.
Yeah, very
Yeah.
good.
Thank you so much.
All right, thank you all so much. Next on the agenda is agenda item number 16, Executive Director's Report.
I'm just so sorry. There's so much. I just want to draw your attention to two things because I know you're starving and tired. The handout that was in front of you for CDRB, we're going to do our packets. The Executive Director's Report is going to be very different. We're going to start sharing much data with you, and it's going to grow each meeting, I anticipate. The handout for CDRB was worked on by the whole team, including Andrew and Vivian, but also all the staff. And it's probably gone through 1,000 iterations. It includes the 5 recommendations and the areas. This is a great handout for you to take to community groups and scream and yell. Keith and I took it to Osage County to Pawhuska a few weeks ago, and it wasn't even in this good a form. And I mean, their jaws just drop, right? Especially on this THC one at the bottom, and that's a near death. It's not a death, but it catches people's attention. So please use that how you want. And we'll talk to you more about this when we have more time. And then I also want to point out on the one sheet where I'm just going to say the area for OJSO in your packet. It's probably on your electronic tablet here. If you get a chance and you can pull it up. I want to highlight a couple things so that everyone understands what you're looking at and you can ask really good questions and we can dig deeper. This is going to continue to grow. So this is a first take of this. We're showing you on this sheet that there for January, February, and March, there were 91 complaints that the OJSO group looked into. They also closed 86 complaints. They may or may not have existed in that quarter. They could be 4 months old, 2 years old, they're a variety of ages. If you're comparing these numbers, like on complaint visits, it says 0 about this. This is about facilities. I think we lost a word there. See, this is why we got it. This is about when it says complaint visits, this is about facilities. Says there were 0. There was actually 1 down here on the chart. You'll see 1 in March. We did not go out and make a visit about that because it was about an issue that we were already working on and did not need to go out. So we were already in the throes of it. So if you see a discrepancy, it is a legitimate, the numbers are correct. Then the 2 numbers to the right, Foster Youth Matters, our friends that just spoke, they too had 91 additional cases that came through on foster youth complaints for January, February, and March. That's a coincidence that there were 91 separate. So I just want you to not go, well, that's confusing. Are they the same? No, they're 2 separate systems. They just absolutely had the same number during that time period. And then there were 53 foster parent complaints in January, February, and March. So there you go. On the back side, this is something that's super important. I want you to understand the next page. We can take complaints for any child serving system. There were 91 of them. Out of the 91 well, I shouldn't say out of that 91. During January, February, March, there were 23 violation reports written. They were all connected to child welfare. They were not all connected to foster care. It's just child welfare in general. They could have been connected to any of the subject matters in the top box. Now, I want to be very, very clear. It is not that all of them were about child welfare because child welfare is the only system that may have an issue. It's because it's the only group that perhaps had issues that rose to the level that got a violations report. I'm also going to tell you, we don't have expertise on staff in mental health or in disability or education or childcare. And when those things happen, we have to contract out and go find someone to help us with that. So there's an inherent bias, and I want to be very clear on what we can do and crank out. So I don't want anyone to leave here and go, wow, mental health's doing great, or this other great area is doing great and child welfare is not. That is not an accurate reflection. This is just about the work that was accomplished. So I just want to be very, very painfully clear about that. And then the violations below, we're showing you the policy that was violated. In the future, it could be a law, it could be code, it could be all kinds of things right here, but we're trying to show you what we wrote them up for. Some of these, it was multiple times, some of it was just once, but I want you to see the types of things that we're doing. So you're gonna see this grow in other ways, but this is our first attempt for you to see what OJSO is doing. So we can't give you specifics about cases, but we can share this stuff in aggregate. So it'll at least let you know that they're working and they're doing things and they're calling people out. The next thing is, what are people doing in turn when we do point these things out? So we're gonna start adding to this about responses and what they say they do in response. The next page in your packet, I wanna explain this too, because it's super important. We have the ability to write per statute a public report if 2 things exist. There is a child death. 3 things. There's a child death, there is DHS history, and there's been an arrest. If there is no arrest, we're not going to write a public report. If there is no history, we are not going to write a report. We are only going to write a report if someone requests that report. We had a request for a report by a reporter. This is what we wrote, and this was actually, I don't know why it says April, but I think about that. This shouldn't have been in this packet because we were going to say January, February, March. I can't tell you how many times we put this packet together, but this is in here. This is about a case you read in the news. And I'm just going to be very specific. I want to be very specific about what information we can share. We can only report about DHS activity that is pertinent to the death, and we can only report about court involvement. So I guarantee you there's all kinds of nitty gritty details and pieces that you have questions about that we're never going to share. But we can share this. This all gets run through Mr. Mowdy and he lets it go. So this is approved and we're putting it in front of you because it's on the website and went into someone else's hands. We will make this a matter of process from now on. So just know that that's there. We used to years ago do these routinely, whether anyone requested or not. The law says upon request. I think there was kind of a standing order that, you know, people just wanted to know. But we don't have the manpower. This takes time. We can't feed this through AI. This has a ton of sensitive data. So someone has to actually think through, read a ton of history. You may think this is a lot. I guarantee you they read volumes to boil it down to this. So you'll see these, but I just want you to know that we are happy to do these upon anyone's request. That would be you too as well. But it's a lot of work. So if it's just that I want to know and not I need to know, I'm doing a report, I'm doing this, then we would ask you, you know, to think about requesting those sparingly. So I did want to go over those specifically because those are a little more nuanced than the rest of the sheets that we gave you for departments. And if you have any questions, I'll answer any of those. I also just want to say in regards to my report and just some things at hand, just so you know, we are involved, you're going to love this. We are involved in the state's meta lawsuit. We are one of the agencies that we're not a party, but our records may be involved at some point or the other in some capacity. Anyway, Mr. Mowdy has been very good about keeping us abreast about what's going on there. And we are complying as needed. And I just want to share that. So if you see anything in the news at some point, just know that's something that we're being a partner and complying when requested. We do get open records requests. Where's Rob? Is he hiding? We're gonna start reporting those to you because we get open requests. There are a lot of them that we cannot and will not comply with without a court order. But we're gonna start showing those to you. Some of them we do comply with. I'm also gonna share that the grand jury petition in Stillwater, I believe the signatures were turned in. I think there was signatures. I also think there's an order or enough signatures to move forward. I do think that I understand there was a court order that came down from Judge Ogden sometime this week, but it hasn't been published, so I don't know what that is. I'll keep you updated on that. We do have, where's Jesse? We have a new employee, Jessie Hamby, with the Office of Juvenile Services Oversight. So thank you for joining our team. She has years of child welfare experience, and we're happy to have her on board. We have other openings, an office manager position, which was Chara's old position. We have a CDRB position that we plan on filling here very soon. We have an administrative assistant with the Office of Planning and Coordination. And our juvenile competency person that position's still open. So we're in the process of trying to fill those. I also just want to say for this new version of the packet, a lot of people put in a lot of time, including the staff, the programmatic staff, but Rob did these sheets 12 times over and he hates a lot of us right now and he needs a weekend. He doesn't, he really, really worked hard. And so thank him if you see him. Mark, thank you for doing the finance stuff. That's really hard, I know. And Lakeisha and Chara, everything you guys do to make this meeting flow. Cannot thank you enough. Ty, thank you for keeping us on track and not letting us go to jail. It's always appreciated. I give him a lot of grief, but he is very, very good natured about it. And John, I just can't thank you enough. And I just want to say, I realized last night when I was thinking about this, I had my oldest child when she went off to college. I used to get irritated because she only called me with problems and she always calls my husband when she wanted to talk about happy things and sports and the Jayhawks did this and all that. I'm like, I don't care. I always got the problems. And then I would feel horrible when I got off the phone with her, but supposedly she felt better, but I felt worse. I feel like John has been that person for me. So I've never called him with anything good. It's always, hey, I don't think it, I think that's absolutely true.
Not true. Not true.
Hey, a heads up, beware, this is coming down the pike. So anyway, you guys have no idea how much, I've, called on him and relied on him for good guidance and sometimes just shouldered as go, oh my God, why? So I can't thank you enough. I really can't. And Mr. Mowdy won't let us give anything for people rolling off the board because supposedly it's an honor to serve. I'm sure you would think otherwise from time to time. But, thank you so much. We cannot appreciate you enough, and we're glad you're staying around for another year. And I look forward to working with you, Kaylee and Jonathan and Jason Hicks. It's gonna be great. So I appreciate all you do, and I can't believe you guys are still here. So I really we would have bought you lunch, but I'll end there
But it's an
because it's
honor
been
to
a lot.
serve.
Yeah. It's an honor, it's an honor.
Thank you so much. Thank you.
You're welcome, you're welcome. And I'm happy to talk about the data and info that you got and when you go home and you look at it and you're like, I don't get that, just call me. I'm sorry, we didn't have enough time to talk about it.
Awesome.
Okay.
Love it. Love the report, love the progress. I don't have anything to say. I just thank you. It has been an honor to serve.
Well,
I've really enjoyed working alongside you and your team. I echo what you said about Mark. Thank you so much for all you did put into this packet and all you continue to do. So, and the rest of the team. So anyway, thank you. Last on the agenda, adjournment.
woo-hoo.
Do we need a motion?
No motion.
No motion. We are adjourned.